All right, today we're jumping right into a fascinating medical puzzle. It's a story told not with words, but with clues written all over the human body. We're going to have to put on our detective hats to figure this one out, because it's all about two really powerful and kind of opposing hormones. You ready? Let's get into it.
So where does our mystery begin? Well, like so many medical cases, it starts with a single patient. Someone who just knows deep down that something is wrong, even if they can't explain exactly what's happening. So here it is. We've got a 39-year-old woman dealing with chronic fatigue, weight gain around her middle, and a puffy, swollen face. Now, you might hear fatigue and weight gain and think, well, that sounds pretty common. But trust me, the way these symptoms are showing up together, that's the key. This specific pattern is our very first big clue. So let's start digging. Okay, let's look at the case file. So she's 39, she's complaining about feeling weak and tired all the time. She's gained a lot of weight, especially in her abdomen, and her skin is so fragile that it tears easily. But here's the detail that should make your ears perk up. She's been on corticosteroid medications for a long time. These are super powerful drugs, and as you're about to see, they can have huge effects on the whole body. Let's just tuck that piece of information away for a minute. It's going to be important.
All right, now let's take a closer look at the physical evidence. Her body is literally giving us a roadmap to the diagnosis. We just need to know how to read the signs.
Okay, first up, clue number 1. Doctors have a name for this. They call it a moon face. And we're not just talking about a little morning puffiness here. No way. This is a very distinct, really full and round look to the face. It's one of the absolute classic signs that something specific is going on.
Then there's clue number 2, how she's gaining weight. It's not happening all over. It's almost all concentrated right in her midsection, what's called central obesity. This is another huge red flag. It tells us that some kind of hormonal issue is basically telling her body, hey, store all the extra fat right here.
And clue number 3, another really distinct feature. It's a fatty deposit on the back of the neck, sometimes called a buffalo hump. Seriously, when you see these 3 things together, the moon face, the central weight gain, and this hump, a very clear picture starts to emerge. For any doctor, the alarm bells are ringing.
And the clues just keep coming. Remember that fragile skin we talked about? Well, that explains why it tears so easily. Then you've got these deep, purplish stretch marks showing up on her abdomen and arms. On top of that, there's extra body and facial hair, plus her muscles feel weak. You have to understand, none of this is random. It's all connected. Every single sign is another piece of the same puzzle.
Okay, so we've got her story, we've got the physical evidence. All the clues are pointing to one thing. It's time to name it.
And the answer is Cushing disease. If you were thinking that, you nailed it. Every single one of those unique signs and symptoms, that's the textbook classic presentation of this condition. So what exactly is Cushing disease? Well, in simple terms, it's what happens when your body is exposed to way too much of a hormone called cortisol for a long time. You've probably heard of cortisol. It's often called the stress hormone, but it does so much more. It affects your metabolism, your immune system, pretty much everything. When you have too much cortisol, it's like an engine running way too hot. Everything gets thrown out of whack, and you get all those symptoms we just went through. So, the next logical question is, where is all this extra cortisol coming from? Well, there are a few possibilities. Sometimes the body just starts overproducing it on its own, maybe because of a tumor on the adrenal or pituitary gland. Or, and remember that clue we filed away earlier? It can be caused by the long-term use of corticosteroid medication. And boom, that's the direct link. Our patient's medical history points right to the cause.
And get this, our patient fits the typical profile to a T. Cushing disease is way more common in women, particularly between the ages of 20 and 50. And at 39 years old, she's smack dab in the middle of that range.
Okay, so we've talked a lot about what too much of a hormone looks like. But you know what? One of the best ways to really get it is to look at the total opposite. What happens when you have not enough? Let's check out the flip side of this coin.
And this really drives home how much our bodies are a balancing act. Think of it like a seesaw. On one side, you have Cushing disease, that's way too much cortisol. On the other side, you have something called Addison disease, which is when your body doesn't produce enough cortisol. They are literally polar opposites.
But wait a second. It's one thing for your cortisol levels to be low. What happens if they don't just drift down slowly, but suddenly they crash? Now that is a whole different and much more dangerous ballgame.
This is what's known as an Addisonian crisis. And the words to focus on here are severe and life-threatening.
This isn't a long-term condition you manage over time. No, this is a full-blown medical emergency that needs immediate, urgent action.
And here's the kicker. This is the part that ties everything together. What's the #1 cause of this life-threatening crisis? It's abruptly stopping the exact same steroid medication that caused our patient's Cushing disease to begin with. Think about it. Her body got lazy. It got so used to the meds supplying the cortisol that it stopped making its own. So if you suddenly take that medication away, the levels just plummet. They crash.
So, wow, we've looked at two complete extremes, right? Let's just pull back for a second and think about the big lesson here. What this whole story is really about is balance. There's a simple line in the source material for this that just says it perfectly. It is the opposite of Cushing disease. That's it. It shows you that our body's chemistry is balanced on a razor's edge. Tip too far one way, you get one illness. Tip too far the other way, you get its complete opposite. It's just an incredible, delicate dance.
Okay, so let's wrap this up with the key takeaways. First, hormones like cortisol are unbelievably powerful messengers in our bodies. Second, too much cortisol gets you Cushing disease. Third, too little cortisol leads to Addison disease. And maybe most importantly, this shows us that stopping a medication like steroids isn't simple. If you do it abruptly, you can trigger a really dangerous crisis.
So I'll leave you with this kind of mind-bending thought. A medication given to help someone can end up causing a disease. And then stopping that same medication can cause a life-threatening crisis. What does that tell you about the incredible power and the incredible delicacy of the hormones running our bodies? Pretty amazing to think about.